Well, welcome everybody to this webinar about the Dani Plan. I heard about the Dani Plan. My name is Desiree Kamika Galloway, by the way. I'm the director of the Autism Housing Network, which is a project of the Madison House Autism Foundation. We seek to be the hub of housing information for families and individuals who have autism or other intellectual and developmental disabilities. If there's other topics or webinars, or resources that you would like to see on the Autism Housing Network, by all means, please shoot us a line, either through the contact form on the website, or you could throw it in the chat. And we love to be able to curate content that is most valuable and helpful for all of you. So today we're going to talk about the Dani Plan. And I heard about the Dani Plan from a few people. And I was like, you know what? I think I'm going to contact them and get a demonstration and just see what this is all about. And I was excited to be able to spend some time with Joel, who walked me through the platform. And one of the things that struck me was that this wasn't just, a digital space to put legal documents. It really is a living platform where you can personalize the information for your loved one. And that information isn't just, again, documents, but a guide, almost a living guide for those who are going to walk beside you and after you, so that they understand your loved one's needs, their support needs, their preferences, the tools that work best for them. And so I just thought that it was a really fantastic, holistic tool that we're excited to bring to the Autism Housing Network and share with all of you. So thank you all for joining and registering, and I'm going to hand it over to Joel.
Awesome. Thank you so much, Desiree, for having us. And thank you all, by the way, for coming out. I know everybody leads such busy lives. So I really am always super grateful when people show up to learn a little bit about the Dani Plan. My name is Joel Perlman. On here, Deb, maybe you want to give a wave as my life partner and business partner, Debbie, co-creator. And we have been we're obviously married. We have three children. Our oldest daughter, Dani, there's a little picture of her there, is 25 now. She has autism. She's non-speaking. She also has epilepsy, and we're lucky to say she is just super sweet. We're really, really lucky to have her. About 5 years ago, Debbie and I were sitting down on our couch and we were talking about kind of a worst case scenario. We're not around anymore. And how would people know how to care for Dani the way we want her cared for, keeping her happy and healthy and safe? We were talking about all those little things. I mean, I know if, we all came off mute now and shared stories, we all could share lots of stories about the little kind of nuances and quirks and OCDs, triggers about our loved ones that only we know and are in our heads, right? For Dani, those things are like Dani loves to have her play with her iPhone. And so she uses it to communicate, to listen to music, to look at pictures. If that's not charged, it's a little bit of a trigger for her. Dani, if she doesn't have headphones, she'll have her fingers in her ears. Or we talk about things like, maybe she has a seizure and will people know how to actually, handle the seizure or where her emergency medicine is. And so we talk a lot about the fact that people talk a lot about housing, and housing is very important. It's super important. But one of the interesting things is housing is just really the roof over their head, where what most of us are the most worried about, and it's kind of part of housing, is how are they cared for once we're not around and caring for them? That's the piece we're really worried about, right? And transitioning this information. So after this discussion, Debbie and I really decided that we owed it to Dani to document her life in a way that other people would really understand way out into the future when we're not around anymore, and something that could kind of live on with her. We also felt like we owed it to any future caregivers to make sure they're not in chaos, trying to figure out all the things that are in our heads, once again, all the things that we understand. And the last piece is we kind of felt like we owed it to ourselves to give us just another sense of peace of mind. that Danny would be cared for the way that we wanted her cared for. We did a lot of research of what was out there. We didn't find anything to be very intuitive, easy to share, secure. That was really the inspiration around creating the Danny Plan, which is a centralized hub to help consolidate and organize all the information needed to properly care for a loved one with a disability. It is simple, it's secure, it is really easy to update, and it's also easy to share. So what started out as a really more like an insurance policy has really become this amazing daily tool for us to be able to share with our whole support circle, rotating caregivers, teachers, therapists, doctors, employers, family and friends, guardians, right? All those people. And some of us have maybe binders, or we have folders, or we have information scattered around our house, right? The the things that's not practical, even if you have a very organized binder, is that we're kind of hoarding the information. And what we really want to be doing with it is sharing it with other people that are going to need to have that information in a secure way, and only sharing the information we're going to want them to have. And so that's kind of one of the major benefits that the Danny Plan has brought to us. So I'm going to give you a demo today of the Danny Plan. Before I jump in, just want you to think about a few quick questions, kind of answer them in your head. The first one would be, if anything happens to you, do you have a detailed plan to make sure whomever's taking over the care of your loved one knows exactly how to care for them? Number two,
Goodness.
does your loved one rotate through new caregivers, therapists, doctors, or more? Number three, is the information and paperwork about your loved one organized, easy to find, easy to update, and easy to share? And number four, do you worry or stress about your loved one's future when you aren't there to care for them? Now, even if you're someone who has a housing situation right now, they are living somewhere else outside the home. There's constant rotating caregivers that we're always dealing with, people that need to get the information on a consistent basis, and understand, again, how to manage or care for your loved one. And that's one of the things that the Danny Plan really allows you to do, is to use it from a training standpoint as well. And I'll show you some of that. We can talk a lot about all the benefits of planning. There's care continuity, peace of mind, safety, health reasons, all kinds of great reasons to plan, even productivity. But I go back to one statement, which is planning protects your child when you can no longer speak for them. Okay, I'm going to go ahead now and I'm going to share the actual Danny plan with you. What you're looking at here is Danny's actual dashboard. Um, the Danny Plan is a web-based application that is extremely mobile friendly. It is not an app. It's not an app on purpose. It's a web-based application, so we can use it over any platform, and we're also constantly enhancing it. So from that standpoint, it makes it much easier if it's a web-based application. But like I said, extremely mobile friendly. It's actually where you're probably going to be using it, and the people that you actually share it with will also be using it the most, is right at their fingertips, be able to grab the phone and make any tweaks or updates that they want to. So this is Danny's actual dashboard right here. A couple things that were really important to Debbie when we created this. One is that we made it really represent life with the colors, the butterfly here, a picture of Danny. And then we always like to start with kind of an intro statement. Who is Danny at her essence, right? I am sweet and silly. My life is full of love. I'm non-speaking, but I have a lot to say. I've discovered a fullness of life through the love of family and friends. Come into my world and experience life through my eyes. Now, the second thing that was really important is that we made this product super, super intuitive, tech friendly for the least techy people. We know there's going to be a lot of aging caregivers using this particular product. So even down to the intro statement, we have a really easy way to do this. Meet Danielle, meet your child's name, and you can do drop down and pick the words that represent them the best. or you can pick your own word. Some of them have words, some of them have phrases, but within a few minutes, you can have a nice little intro statement. Down here, what you'll see is a bunch of different tiles. You have about me, key people, medical and therapy, emergency, all the way down to finances, housing, and legal. You also have an add a category. So anything that might be missing, you can add as many main categories as you would like. Underneath these main categories are quite a few subcategories. So under about me, you have my likes, most important things to know about me, my dislikes, strengths. Under key people, family, caregivers, friends. Under medical and therapy, we have medication, insurance, doctors, diagnosis, therapy, medical equipment, assistive technology. So it's pretty thorough. Now, I had a mom say to me recently, I'd love to add my daughter's goals. And I said, great, where do you think it would best fit? And she said, how about under about me? And I said, perfect, let's go under about me. We'll add a new subcategory. I'll go ahead and I'll type in goals here. I'm not going to do contact info or notifications. I'll save it. And now you have a brand new subcategory that just didn't exist right here. Um, Now, if I go to add a new entry here, many of the sections are formatted like this. What you'll see here, it says goals in the section. Please describe everything we need to know about Danny's goals. Now, many of the sections have titles. They have the ability to fill out information the way you'd like to fill it out. So in a bullet list, a narrative to tell a story or explain something, or a numbered list, which is great for step-by-step routines and prioritization. So thinking about that from a standpoint of training people understanding how to hand a morning routine, toileting routine, whatever it happens to be. All the sections have additional info. They all have the ability to add links. So you can add video links, you can add where to buy something, you can have patient portal links. Again, this is a hub for everything about your child. You can always just come to one spot on your computer or your phone and you can find anything you need. On top of that, all the documents that we've gotten since the time they were young, legal documents, financial documents, IEPs, whatever it happens to be, medical documents, everything you can store in the Danny Plan and you can share it. You can also do photos as well. Let me show you what some of the output looks like. Okay, so let's all picture for a second new caregiver, whether they're live at home with you or they live at in some housing community or whatnot. Either way, new person comes in, new volunteer for the day, new caregiver, whoever it happens to be, and there's a lot about your child that they may need to know. You're going to go ahead and I'll show you how to share in a second. But maybe once they get the Danny Plan in front of them, right from their phone, they'll be able to go, oh, I wonder what Danny likes to do. Well, Danny likes to play with her phones and listen to music. Danny likes to walk in nature. Maybe they have to get a hold of Debbie or myself or another emergency contact because we're not available. Maybe they have to administer medication. So here's all the details of the medication down to dosage and time. And then for future caregivers and guardians, when you're no longer around anymore, you have prescribing doctor and pharmacy name. Debbie added a picture of the dispenser that we use, along with pictures of the bottles themselves. So you can actually correlate the information above with the information on the bottle itself. Okay. One of the things I mentioned was your ability to actually use video to explain how to do things. I'm going to show you what some of the step-by-step routines look like, but let's take a look at a quick video. This is one of Debbie showing how to do Danny's morning routine.
All right, so this is a process for getting Dani her pills in the morning. So you come over to the cupboard, which is right on top of the coffee pot. We keep all of her medications in this nice neat container. And there's a list of them here, but I happen to know them by heart. So I'm going to grab one Lamictal, one Sertraline, one Cletidine, the best container ever, and one Keppra. And Dani already has her coffee, but I'm going to take her pills over to her. I like to hand them to her, put them on the counter in front of her. Good morning, Dan. Here are her 4 pills. We'll take them one at a time. And wash it down with a little bit of our coffee. And that's her process.
So people are using video for a lot of different things. Show what a seizure looks like, how to handle a meltdown. Even I'll show you one with Debbie, showing how to get Danny's bed ready to go to sleep at night as well. Okay. Again, it would almost be better for them to have a Danny plan in front of them than it would for us to explain everything right out of our heads with the ideas that they're very likely going to forget anything. So we could have a brand new caregiver coming in, first time they're ever dealing with Danny, maybe they have to deal with her morning routine. They can go right over to her morning routine, again, right on their phone while they're in their bedroom, open her door at 8:30, say good morning, she'll stir. We can go down to a toileting routine, a dressing routine, a shower routine, a menses routine, brushing teeth, or here's one more example of a video, preparing Danny's bed for sleep.
So Danny's bed always has a bunch of pillows on it, which is obviously not easy for her to go to sleep with. So I take off all the pillows and I put them in a stack over here on the floor. And I just pile them up really high and I leave her just the main pillows. So I leave her the regular sleep pillows, the ones in the tie-dye, and then her regular sleep pillows. And then everything else, all these other decorative pillows, the fluffies and the ones with the words, those all get stacked over here and she can put them back on her bed in the morning.
Okay, I always like to do a poll, and my poll is, does Danny really need this many pillows on her bed? So a big no. So if you're on my side, feel free to put it in the chat. Okay. So again, as you can see, pretty powerful from a standpoint of being able to share this with different people, whether it's an employer, new caregivers, new therapists, whoever needs to see information. Okay, then we have again all the documents that just keep on coming and they don't stop coming. So some of of us have them in binders, folders on our computer somewhere saved, or we're having to make phone calls. Can I get a copy of that? Now, whenever you get a document you're going to need, you're going to go ahead and you're going to upload it right into the Danny Plan. You can do that in any of these sections, medical, directly. But to find them, you can come right over here to links, documents, and photos. You can come right down here. Super easy to find anything. It'll be much easier than finding anywhere, even your computer, because each one has a main category, subcategory, description. I like to use the example of an IEP. Danny moves to a new school and somebody'd like to get a copy of her IEP. Here's a quick example of what that looks like right there. And what's really cool is Gabby and I could be on an errand at Target. We can get that call. Can I get a copy of Danny's current IEP? And we could go ahead and write from my phone or the computer. I could go ahead and add that individual's email, or maybe they're already a shared user, and I could send that document right out to them. Now, keep in mind, we are HIPAA compliant. So anything that has a shield on it, a medical document, a legal document, or a financial document, you'll see these shields. If I were to send out this particular document to someone, add their email, you'll see down here it says share this protected info code. So I would have to give this code out, 342818, for them to be able to actually open up this particular document. Okay. Let's talk about the real power of the plan, right? Because we know everything and we have everything in our heads. The real power of this plan is to be able to share it with other people, right? Three different ways to share the plan. You can either email or print a PDF. You're going to do that for people who aren't in their lives very often, a volunteer for the day. Maybe it's just someone who isn't that tech savvy and they prefer to just have a printed copy. The third people are going to be people that are in their lives consistently, ongoing caregivers, family members, friends, guardians, maybe a teacher, those type of things. You're going to go ahead, you'll go here to share new profile, you put their email in, their name, you send them a little message down here, you'll pick their role. A co-administrator role, would be like for a spouse or a guardian, someone who's going to have the exact same functionality as you'll have. Um, and then most people are going to be shared users for family or friends or caregivers. So for my sister, I'm going to go ahead and decide which information I want to give her. For her, I'm going to give her everything, including finances and legal, because I want her to have it and I trust her. For a caregiver, I'm going to be much more selective. I'm not going to give them finances and legal, but I'm going to give them about me and emergency and food and diet, key people. Under medical and therapy, I'm going to probably give them medication because they're going to have to administer meds, but I don't have to give them all this other information that's not really relevant to them. Now, once I've decided what to give them, I can then decide what level of access. Do I want them to just view the information? Do I want them to actually help us keep it updated? Because the idea of the
Yeah.
data plan is it's always at your fingertips. So anytime there's a little change or tweak, anytime there's a new behavior, a new food they like, a new like, something you want to add, you can do it on the fly. I like to use the example you're at a doctor's appointment with them and they change the medication. You can go right into the Dani plan and tweak it right there. So we have a caregiver that's like family with us. We give them the ability to make changes. They make just as many, maybe more than we do. And you can also do add only as well if you don't want anybody to delete any information. Okay. All right. Just gonna do a quick time check. All right. A few more things here.
Thank you. You know,
Okay. Um, so the other thing you can do, I want to show you, I talked a little bit about printing the plan. And when you print, there's a few different ways you can do that. You can either print profiles, so the same way you did when you shared it electronically, you can go ahead and pick the sections or subcategories that you would like to print out. You can name that, you can save it. So once you do it once, it'll be in there automatically. A caregiver profile, anyone that comes in the home, school, teacher, and staff. This one's called medications and insurance. Debbie did print before doctor's appointments. I'll give you a quick sneak peek at the, if I can find it. There we go. This is the complete plan printed out. What you're going to see is all the Dani's main information up at the top. All the main categories are in these blue bars. All the subcategories are in bold, and each new main category is going to be in a blue bar at the top of a page. So real clean, real easy to share. And again, if you prefer to share by giving people copies of the printed copy, you can always update them and give them new printed copies anytime you want. Okay. All right, a few more functionalities I want you guys to know about, and then we'll stop shortly for some questions. Is the ability to set notifications. So if you want to set some for yourselves, if you want to set them for your loved one, if they have the cognitive ability where they have their own phone, if you want to send them for caregivers, brand new caregiver comes in. I like to use the example. I'm going to go back to medications. Here's daily notifications. So I can go ahead and type in a message here, give meds, put the medication with the dosage and time. I could pick the days this particular individual is going to work. I'd go ahead and pick the time that Dani would take this particular medication. I would set that. And then over here, I could pick their email or their phone. I'm going to pick phone because it's a little more practical. So Andrea on Monday, Wednesday, and Thursday at 1 p.m. will get a message texted her to give meds Lamictal. And you can do any message that you would like them to get. You could do time to, brush your teeth, time to leave for work, whatever's helpful. You can also do date specific notifications. So I have one called time to turn in the Guardian form, and I make that reoccurring 30 days before it's due every year. You could do time to take Danny to the dentist and pick the individual again that's taking Danny to the dentist. So there's a nice way of keeping reminders. We also have a shared calendar. So if you want all the people in the support circle to have share in your loved one's calendar, here's a user key. Everybody has a different color, so everybody would be able to see what they're doing with your loved one when they're doing it. Okay, the journal has become really, really kind of like a fan favorite for Dani Plan members. And the journal is like a great communication tool. It's a way of keeping information that you need to know in your head, but also sharing it with other people. So you can, all these journals are time stamped and date stamped. And you can do any type of journal that you would like. So if I go add new journal here, you have general update, which might just be from your caregiver, from a caregiver to us, let's say, at the end of the day. I'll show you an example of that. They all have a title, journal entry, the time spent if you want to track someone's time. And then you can check this little box here, and the caregiver can go ahead and pick our names and just email us these particular journal entries. We could also do the same back to the caregiver. So again, you're not necessarily in your Dani Plan every single day, but you are in your email. So getting these journal entries to your email is really nice. Now, the other nice thing is you can add any type of journal that you want. All of these are journals that Debbie created. You can just go to add new journal category. You can create it. But here's a behavior journal if you want to track behaviors. Dani's period. So we know when her period is. There's one called neurologist. So Debbie, every time she takes Dani to the neurologist, she makes notes. She can always go back to the day and time and look exactly what happened at the last appointment. One of the other nice things is you can export this information. So you can export it any journal you want. So if you want to look at behaviors and patterns, when they got their period, whatever it happens to be, any notes from any doctor, you can have them all exported to a spreadsheet. Here's an example of a journal entry here. Dani had a great day today, went for a coffee at Starbucks. We went on a long walk in nature. We went to pickleball. We ate at Chipotle. She took her meds after we ate. So this happens to be a quick one we actually did yesterday. True. Dani woke up with her period this morning. Good mood last few days, one sad episode, and had some stomach pain. So nice way of tracking information. Okay. Couple other things, and then I'm going to stop for questions. So one of the things that if you decide to share the Dani Plan with someone, you've inputted a bunch of information here, and we're going to talk a little bit about that and the fact that it does take a little bit of time to get it done, but how it's really not an overwhelming tool at all, and it's easy to do. We'll talk a little bit about that. But when you're sharing it out with someone and they're getting it for the first time, they may not know. They're not going to know exactly where you put the information that you put. So they'd have to probably play with it for a while. The beauty is over here, you'll see search your Dani Plan with AI. This is your own personal little AI. It's only within the walls of your individual loved one's plans. It doesn't go outside of it at all. It's just searching what's in the plan. So let's say it's their first day. They want to deal with Dani's morning routine, but they're not exactly sure where to go. They could just type in morning routine and it will pull it up within seconds. Again, they're going to see this on their phone and they can view more detail, see some of the other ones. From our standpoint, maybe we need to find a document very quickly also. So you can just type in IEP. It's looking in the system for anywhere it sees IEP here. So it's going to go ahead. Down here, you'll see links, documents, and photos. If we click on the screen tool here and go down here, you'll see it highlights the IEP and we can go ahead and send it out. So just think about how, from a standpoint, there's a few different levels of this. There's us having a tool to make sure Dani is protected in the future. There's a training tool. So to make it super easy, there's care continuity. Everybody's doing the same thing for a standpoint of health, safety, but also for our loved ones to get what they need and what they want so they're not triggered. And then there's a last piece for us, which is productivity. Everything in one spot. No more searching for information or documents or any information you need. You're only going to one spot. So those are all the benefits. Okay, I'm going to talk to you real quick about security, and then I'm going to stop. and answer questions. So the Dani plan is stored in the Amazon cloud at the highest level of security. It is 100% encrypted, which means if anybody were to try to hack in, all they would see is gibberish. Everybody, when you sign up, needs to go through two-step authentication, just like your bank. You'll need to have a text sent to your phone or your email. Anybody that you share this with electronically will also have to set up their own username and password and have go through two-step authentication. We are HIPAA compliant. If you know anything about HIPAA compliance, it's just it took us about 12 months to become HIPAA compliant, but it is a large amount of security standards. And then the last piece we have when you sign up, they will ask you to set a PIN code for yourself. And you can pin protect any field you want. So if you happen to be putting a social security number in there, passwords, whatever information you want to block out, you can pin protect those pieces of information. And people, you'd have to put your pin in for people to have to, for you to be able to view it. So, okay. I'm going to stop here. And Deb, I don't know if there's been any questions in the chat. First of all, feel free to throw questions in the chat um, or raise your hand if you'd like. It might be a little harder for me to do that, but any questions in the chat thus far, Deb?
Nothing in the chat so far.
Okay. Well, what questions do you guys have? Feel free to come off mute or put it in the chat. Feedback and or questions. Looks like there's a couple questions.
Pricing, couple questions about pricing, Joel.
Yeah, great question. And I'm going to show you that before you leave. Also, I'm going to give you guys a discount. Autism Housing Network, we've partnered with them. There's an automatic discount that you guys get. We're going to give you a little bit bigger one tonight if you decide to sign up in the next day or so. But the price of the plan is it is a subscription. It's $99 per year. That's for your loved one's plan. You can share with as many people as you want to. There's no additional charge for sharing with 10, 20, 30, 50 people. So you're literally just paying for that one individual's plan. You can also purchase a 5-year subscription, a 10-year subscription, or a lifetime. The 5-year subscription is $395. It's like a 20% discount if you buy it in a 5-year pack. If you did a 10-year, it's $695. It comes with it's like a 30% discount. And we also have a lifetime as well that is $1795. So if your child is young and going to live another 50, 60 years, it may make sense for you from the best value to think about the lifetime as well.
All right, another question came up, Joel. It says, what tech support is there?
Yeah, great question. So we're really, really responsive from a customer experience standpoint. We have 4 different ways that you can be helped. One is we have video tutorials for you to know how to do things. The second one is we have FAQs. The third is we have a live chat. This is actually going to be done by AI chat. And the fourth is you can go ahead and email support. Now, on top of that, when you go ahead and sign up for the Dani plan, you're going to be offered, it's going to say, which subscription do you want? So let's just say you do the annual plan and you go ahead and sign up for it. Below that, it's going to say, do you want support? The first thing it's going to offer you is a 45-minute free quick start of support, of which Debbie kind of manages all of the onboarders. She's also one of them that you may meet with. And she will, in fact, I'm going to let Debbie kind of give you a little rundown on what she does and how she can help. But she certainly can also help you to make sure you get acclimated to the site. So, Deb.
Yeah, so basically after you register, we send you an email right away where you can sign up for a 1-hour onboarding session. That's with me, or I have a few people that work under me. They're also wonderful at onboarding sessions. And what we do during that 45-minute to 1-hour session is we talk about the plan, the features of the plan. I have you make a few entries. And then I talk to you more about creating a plan that you feel really comfortable with and something that you feel you can move forward with easily and without stress. I know sometimes you can look at this plan or even listen to Joel, and there's a lot of information that seems that it needs to go in here. I have a way of breaking it down for you that feels really palatable and easy to do and easy to get your information in there. So I'll just work with you getting a plan set up for you that you feel comfortable with and making sure you understand all of the features that we offer on the site and kind of reviewing what Joel went over as well. Okay. Beyond that question, tech support. Next up, great question, Alexis. It says, are folks using this also for elderly parents? Joel, go ahead.
Yeah, great question. So we have three different Dani plans. We have Dani Plan Disability, Dani Plan Aging, and Dani Plan Life. So when you go to sign up, you're going to pick the one that is the most that you need for the individual. Here's an example of the aging plan. The only thing different, actually, this is not the aging plan. That one is the aging plan, Rosie's plan. The only thing different between the plans, they all function the same, are the tiles that they default to. So an example is under aging, we have a tile called elder care, support staff, long-term care insurance, preferred hospital. We even have one called end of life, funeral arrangements, obituaries, letters to friends. In the aging one, we have one called recipes, where Debbie put down, Grandma Rosie's famous chicken noodle soup, things that you might want to, hold on to, and those type of things. We also have a life plan. That would be like I have my own plan here, Joel's plan, and this is for me to have all of my stuff in here. So if when something happens to me, Debbie's not in chaos trying to figure out where everything is. So we have all, and we do have many people that purchase one for for their child who has a disability, but also for their aging parent or themselves. So that does happen. Great
Yeah, or
question.
even their other children. We're a family of five. Everybody in our family has a plan because you can really see the value of having everything in one place, all nice and neatly organized. So our other two kids also have Danny plans that are fully populated as well.
Exactly. So if I needed something for Alex, my daughter Alex, and I needed a piece of info, I could go right in here and look at her med info or whatnot. So we're always going to the Danny plan to get any one piece of information we would ever need. Yeah.
Yep, copies of passports, social security numbers, things like that. Okay, moving on. As a subscription, who is getting the annual fee to be paid? So whoever is the original subscriber will get that reminder annually to pay if you're on a 1 year subscription.
Correct.
Somebody else said you mentioned guardianship. Can Danny decide she doesn't want others knowing this information? I'll let you take that, Joel.
Yeah, well, I mean, the basically you have the ability to decide with your child what you guys want to share and what you don't want to share, basically. So that's going to be really on you and the individual to make those decisions. So I don't know if you have any other answer for that, Deb.
No, I would say exactly that. It's kind of like family dependent and
Yeah.
child dependent as well. Can you set up more than one account? Yes, you can. Is there capability of using or creating fillable forms to use in the process of journaling? That's a great question. Right now, it's an empty template to fill out. Joel, what is your thought on that?
Yeah, well, one thing I'll tell you is that we have, first of all, that is a really great idea. And whenever someone brings a great idea up, I like to tell people that this product was really, it's evolved immensely. It's so many of the ideas that we have, the enhancements like notifications, calendar, journal, video, being able to move tiles around, all of that have really come from individuals like you, other people in the community, family members giving us ideas. So that's a wonderful idea. We take all of the ideas and we put them on our roadmap. And then if we hear them kind of over and over again, we absolutely end up kind of enhancing and creating. But there's little tweaks we do all the time, believe it or not. So I love that idea. Right now, there is no customization to it. But you can take the notes pretty, yeah, it's not fill in the blank. You'd have to use these at this moment, but really good idea.
Right. And additionally, in the journal, you are able to upload links, documents, and photos just like every other entry. So you can put information in there through links, documents, and photos as well.
And one other thing about the journal that's great is that the journal you'll be able to share privately as well. So you can have a caregiver journal, a family journal, a journal with you and just your spouse. You can decide who you want to see any particular journal as well.
Okay, so somebody said, is there a monthly fee or maintenance fee or just the annual? Just the annual charge. The only additional fee you'll ever pay is if you want to get extra support while you're doing your plan. We do offer during monthly sessions, we call them community series. And so it's not really a one-on-one experience, but it's more getting together as a group. Different Danny Plan members hop on. We have 4 different session types where you can come on, connect with other users, get information from them, ideas from them, connect with them. So that's really great. But the only actual fee would be is if you wanted to schedule a one-on-one additional support hour with one of our staff.
Yeah, so this is kind of what it looks like. This is actually not exactly. When you sign up, you pick your plan, and then
Mhm.
it'll say select your level of support. The
Okay.
first one, which isn't on here, is going to be one that says free quick start. That's the thing that Debbie and her team does. She does all of these. Now, what some people decide they want to do is they prefer to have more support and more help. These aren't annual fees, they're one time.
I get
If
it.
you were to pick 2 hours or 4 hours or whatnot, generally it would be enough help. You're going to pick enough help for you to complete it. Now, I always say, like for me, I would want accountability. I would not because it's hard, because I probably wouldn't do it unless I had somebody holding me accountable. So I would probably pay for additional support. Debbie's someone who's a quick start and would just kind of do the free one, and she'd make sure she put time on her calendar. So I always say, yourself. And honestly, we only built
Go
out
get them.
these
Go get
support
chips.
plans.
Go get chips.
Deb, you're not on mute.
Oh, I'm sorry. Sorry.
You're talking to
Danny just
Danny.
hopped in here. Sorry, guys. Hold on. Let me just move it.
It's like on cue. Danny's coming in to introduce herself. Um, so we actually added these because people were asking for more support. They were saying, could we do this? Could we pay you and do like 4 or 5 sessions and you help us build out the whole plan? So, like I said, I would say it's probably around 50% of people just do the quick start. They get one. Debbie and her team work with you to just figure out a time, like timing that works for you, when you want to work on it, put it in your calendar. Not an overwhelming thing to do. Once you get started, you'll get momentum. And there's really no race. Now you have something at your fingertips you can just be constantly tweaking and getting up to date. So, any other questions that have come in, Deb?
No, that is it for the questions in the chat.
Okay, great. One other thing to mention to you is that you do have the ability. I mentioned that we have tiles, different tiles, a lot of different tiles from aging. We have different tiles from life. Um, if you go to manage tiles here, first of all, you can hide tiles from your dashboard that aren't relevant anymore. So Danny will not be in school after next year. We can go ahead and make it a hidden tile. Somebody said to me the other day, I keep my son's passwords. Do you have digital? You could take digital and I can move it over so it's now in the visible tiles. I can also decide if I want to move any of these up or down. So if I want family values to be the thing at the top, the number one thing here. I save it. And now again, you can make this really your own. So family values is number one, education is gone, and we've added digital as well. So all of the tiles from all the other plans are available. When someone gets to the point where they're aging, they can grab the aging tile and add it in as well. Any other questions popping up? Okay. Deb, am I missing anything? No, it looks like maybe one question just came in.
Yep. Can you start with support and then next year go to the plan that does not offer support?
Well, the support actually is just a one-time fee. So you're not going to pay for it more than this year. You're just going to pay for it once. Hopefully, I answered your question.
Mhm. Okay, that looks like it for the questions, and I can't think of anything that you didn't cover.
Okay, great. Well, feel free. We got another 12 minutes. I don't want to keep anybody longer than they need to, but I do want to give you guys I'm going to give you a coupon code. So before I give you the coupon code, actually, I want to do two things really quick. One is Deb, should we do Jackie or Matt testimonial?
Oh, they're both
Okay.
so good. Yeah, Matt.
Okay. All right. I just want to give you guys a quick testimonial, unsolicited from somebody.
We designed these pants to help
Well,
your belly men
that's
feel
not
good
good.
every day. And thanks to
Okay.
support. This special sale.
So about 6 months ago, I met Dani Plan, and I instantly became a fan because for me, it did something very important. Let me give you a little analogy. If you remember when Steve Jobs and Apple came out with the iPod, that was a revolutionary new technology that allowed people to walk around with their entire music library in their pockets. And Dani is a little bit like that for the disability world. Every piece of information that's important is all in one place on my desktop, but also on my phone. So no matter where I go, I have the documents, the documentation, and the information on Jonah across a whole platitude of different areas. So that whole iPod analogy, everything in one place, really was important for me. The other one is that I have a lot of documentation, and that some of it was sitting on my laptop, some of it was in my file cabinet, some was sitting on my desk, and I could never find the documents that I needed when the time came to need those documents. Dani Plan has gotten rid of that entire organizational problem for me. Now everything that I need is in one place. And importantly, everything in one place for the day that I'm no longer here. So that immediately Jonah's trustees and supporters can have access to all of the information that I have on Jonah at their fingertips. And so for me, the Dani Plan does one big important thing, and that's give me peace of mind that my son will be well taken care of.
Okay. Thank you.
بهم ولا خوف
Boy.
عليهم ولا هم
Sorry about that.
يحزنون الذين يأكلون
Not sure
الربا
why
لا
this is on, but okay. All right. Let's see here. All right, I'm gonna quickly show you. Okay, so one of the things you guys should know is that the the Autism Housing Network has an ongoing discount that you guys can use. It's HAN25 is the code, and it's for 25% off your annual subscription. Okay, so that'll be good anytime, just so you know. There's a little extra incentive to sign up in the next day or so. We do that for a couple reasons. Our goal really is to inspire you to build a plan for your loved one. We're certainly biased to the Dani Plan. We think it's a better tool, and we love building our community with people like you. So if you're inspired by the Dani Plan and you think it's a great tool and you sign up in the next 24 hours, this same code HAN25 will give you 30% off your first year subscription. So it'll be $69 for the first year. If you are not 100% that you want to move forward and you want to give it a try, you can also do a 14-day free trial. And you, as long as you do that, sign up for that in the next 24 hours, you can put this code in AHN25 and you'll still get the discount and be able to experiment for the next 14 days. I wanted to put that there are the 5-year, the 10-year, and I do have discounts for those. If you do decide you want to do a longer one, there's a 10% discount on the 5-year, 10% off the 10-year, and 10% off the lifetime. Here's the kind of prices if you did in the next 24 hours, and here's the retail prices. But again, keep in mind that your $99 will be more like $75 anytime that you decide to sign up for it with the 25% off. If you have any questions, please feel free to reach out to me or customer care at dannyplan.com. If you are interested in signing up, just go to dannyplan.com, click sign up in the right corner, put in that code AHN25, and you'll be good to go. So happy to answer any other questions you might have.
Great
Oh, what happens if I
question.
go to?
Yeah, comes up every time. I love it.
Yeah, no, it's a great question.
Mhm.
So what I've been telling people is at this point, we're not going to go
Well,
out
read
of
the question so everybody knows what it is, Joel.
Oh, sorry about that. It basically says, what happens if you go out of business? It's a great question. There's a few different things. First of all, um, we there's two big things. There's the personal side, which is Debbie and I built this first and foremost for Dani, and then our community. Dani is young and healthy. She's 25 years old. We plan on her living another 50, 60 years very healthily. And we want her to have this for the rest of her life. We also built it for our community so they could have that. Debbie and I look at this as part of our legacy. So that's kind of the personal side. The professional side, at this point, we're about 2.5 years in. We have so many organizations we're tied to, including Autism Society of America, who's a partner of ours, many different estate planning firms, many ARCs out there, many, many different types of organizations that count on the Dani Plan. They're using it as their own tool. Some of them use it as their own organizational tool, and we have many, many families signed up. So we're already a very viable business. We will not be going out of business. Will we ever transition? Of course, at some point we'll transition. But Debbie and I have 3 other equity partners. As a team, we've all decided that when the time does come to transition, which again is not going to happen anytime soon, Debbie and I are having a blast and loving being connected with this community, that we will transition it over to an individual or an organization that has the same commitment to our community as we do. So it's a great question. Thank you. And important. All right, well, I'll stay on for the next few minutes or so if anybody has any questions. If you don't have any more, feel free to pop off. I do want to thank you, for showing up. Really, really grateful that you guys took time out of your day to learn about the Dani Plan. We certainly would love to have you as part of our community if you're interested. And yeah, here to help if you guys are looking for any. So, thanks, Cynthia.